So here's some tips to optimizing the glutathione levels in your body. A few things that you can eat, including your diet: garlic, onions, cruciferous vegetables like broccoli, kale, collards, cabbage, cauliflower. You know, again, it always comes back to just having a healthy diet, eating things that come out of the ground. Those will increase glutathione levels, which boosts the immune system. The whey protein that we have in the office, if you're taking that, that helps boost your immune system by increasing glutathione levels. Supplements like selenium and milk thistle, alpha-lipoic acid, and acetylcysteine, again, help boost glutathione levels. A lot of those are found in the Daily Detox. If you're taking that, you're getting most of those. Again, one of the primary features of the Daily Detox is to increase glutathione levels so that your immune system is stronger. That's the whole point of the Daily Detox, really. Talked about that. If we look at here, 4-step process taking care of cancer or preventing cancer. 4 steps. Stop taking sugar, right? Replace it with something like stevia or xylitol. Those are sweeteners that are safe. Change your damaged fats to healthy fats. Again, that goes back to the meat that you're eating and a lot of other information that we've talked about in previous talks about damaged fats. But you got to be eating the right fats. And again, the information's in the book. Change the meats you're eating, and tons of vegetables. Can't have enough vegetables. It should be the number one thing you're eating, lots of vegetables. Let's talk about vitamin D for a second. As far as supplementation goes, the research shows you that this is probably the best thing you could possibly supplement when it comes to increasing the strength of your immune system, which prevents cancer, right? So to say vitamin D prevents cancer would be a true statement because it boosts your immune system. A lot of research actually is being done right now on this type of stuff. So it's very new, cutting edge stuff. But the research is showing that the more vitamin D you have, the more cancer cells your body kills. This one was an interesting quote. A researcher at the State University of New York was quoted as saying when she was doing some experiments with vitamin D in cancer patients, within a few days, half of the cancer cells shriveled up and died. So, you want to take chemotherapy or vitamin D? I'd rather take vitamin D, right? We should be getting it from the sun anyways, but none of us spend enough time in the sun. If you're out in the sun during the midday with at least half your body exposed for at least 15 minutes, then you're at least not as severely deficient in vitamin D as the rest of us. Okay? Those are kind of the guidelines as to how much sun exposure you should get so you get enough vitamin D. However, because of where we live, we're so far north of the equator that even if we're doing that in Wisconsin, we still have a tendency to be deficient. Studies have shown that about 70 to 80% of the average population around here is deficient in vitamin D. Most of us don't know. Okay? So, supplement with a vitamin D. It's not going to hurt you. The studies have shown all the way up to 50,000 international units with no side effects. All that's recommended is 5,000. It's not even close to that upper limit that's been studied. Take your vitamin D. Again, it's a proactive approach. Don't wait until something bad happens and I'll say, oh, I want to treat this with vitamin D. Don't look at it that way. Don't think about that. Be proactive. Realize that vitamin D is an essential vitamin in your diet, and you should just be supplementing with it. Always get at least 5,000 of it a day so that you prevent these problems. Not only is it good at preventing cancer, but because it boosts your immune system, you're a lot less likely to get colds and flus. Would I rather have a lot of vitamin D or go get a flu shot? I'd much rather have more vitamin D, right? The flu shot's got thimerosal in it, mercury, it's a toxin. So, we want to continue activating the cancer-killing system, which is the immune system we've been talking about the whole time. And again, I talked about how the immune system is controlled by your brain. And this slide is for those people that really like the nitty-gritty. You want to really see the chemistry and the science behind it. You know, what this does, you call your cancer-killing system into high gear. Your nervous system releases interleukin-2, and then interleukin-2 ends up releasing growth factors of T cells, which attack specific disease-causing agents. Activation of T cells and natural killer cells. Natural killer cells help kill viruses and cancer, things like that. Most people don't want to know that minute detail, right? And probably none of you do either. If you do, ask for the slide. You can have it because the science is there. But in our terms of what we can understand and what we care about, what this means is that interleukin-2 is really important for boosting your immune system so that you fight off cancer. Well, guess what increases interleukin-2? Getting adjusted. Your chiropractic adjustment has been shown through research that they've studied it 15 minutes after an adjustment. They've studied it and shown that your interleukin-2 is higher. It has a direct effect on it. Why? Because when you get adjusted, you remove the pressure off of the nerve so that the brain can talk to the immune system so that it works properly. So all you got to learn from those complicated, boring slides and terms is that when you get adjusted, you're boosting your immune system, which helps you fight off cancer, helps prevent cancer, helps fight cancer. More research shows that after an adjustment, they studied it for 15 minutes, they showed an increase in white blood cells. Those are more immune system cells, again proving that your immune system is stronger when you get adjusted. All the more reason to get regular chiropractic adjustments. Whether you have back pain or not, that doesn't matter. The study didn't say people only with back pain. No, it was anybody with a subluxation, whether you knew it or not, putting pressure on your nerve. Got the benefit. So when we look at chiropractic, now we already talked about that, about how the brain communicates with all the body. I don't think you guys need to talk about it again. So here are your warning signs and the symptoms where when you do have a subluxation, an area in your spine that's putting pressure on the nerve, that decreases your immune system, which makes you more susceptible to cancer. Here's some of your warning signs and symptoms that this might be going on, okay? Because it's not just, oh, my back hurts, that's the only sign and symptom. No. Headaches, insomnia, meaning you can't sleep, brain fog, high blood pressure, infertility, depression, fatigue, diabetes, sciatica, neck pain. There's a long list, right? Menstrual problems, weight loss, low back pain, dizziness, acid reflux, numbness, tingling, allergies, asthma. Sometimes it's the most, what do I want to say, scary warning sign is no warning sign at all, right? The people that have cancer developing in them had no clue. Then they finally have something go on. They go to the doctor, and the doctor says, "Oh, that's probably been going in there a good decade." Where was the warning? You didn't know. Sometimes there are no warning signs. That's the scariest, is the no warning signs. Sometimes there are, sometimes there aren't. The only way you know them is if you get checked, right? That's why it's always recommended that you get checked by your chiropractor, you get checked by your doctor, physical exam, you get checked by your dentist, checked by your eye doctor. That's why they want to check. Even if you don't have a problem that you know of, underlying diseases can be growing in you with no signs and symptoms. Sometimes there's signs and symptoms, sometimes there's not. The reason this list is so extensive for possible warning signs that you have a subluxation is because when you interfere with your nervous system, the effects are far outreaching, right? It could affect virtually anything because your nervous system controls everything. So almost any sign or symptom you could think of, you could put on this list, because if you have a subluxation in that area that's causing the irritation on the nerve that goes to that spot, that can be the cause. So the first step in the fight, what do you got to do? Well, go see a chiropractor for one thing. Make sure you get the pressure off of the nerves so that your nervous system can control your immune system, which fights off cancer. Whether that's seeing me or seeing another chiropractor, if you have another chiropractor, see them, that's fine. But you should be getting regular chiropractic checkups, and if there's something wrong, they should be adjusted areas. So, if you've never seen a chiropractor or it's been a long time, get signed up, either in here or with somebody else, right? Upcoming events. We try to do one of these about once a month, once every other month, somewhere in there, where I'm always teaching you another piece of the puzzle of how you can be healthy how you can have a long, happy, healthy life, right? This is one piece of the puzzle. Today we talked a lot about preventing cancer. Normally I have a date and time that I give you, but it's kind of tentative now because we're waiting on a baby. And next month, it gets to the point where we start thinking, we don't know when it's gonna come, when it's gonna happen. So the date's kind of tentative. If you're interested in upcoming events, Dr. Bree can give you a sheet of the tentative dates and times for the remainder of the year. But just understand those may be subject to change. And we'll let you know if you're interested in that. You're signed up. We'll let you know if it does change. So ask her about that stuff back there. Guys, that wraps it up for me.